Hi, I'm Sylvia Azania, and today we are going to talk about week 9 of pregnancy. We will discuss in detail the changes in the embryo. We will also address the symptoms that the mother may experience. Then we'll talk about prenatal care during this 9th week of pregnancy, provide some recommendations, and finally answer frequently asked questions that users may have on this topic. Week 9 of pregnancy is a time of significant changes for the baby, as it nearly doubles in size. At 9 weeks, the embryo measures approximately 2.5 or 3 centimeters. Its weight is around 3 grams. Among the most significant changes in its development are the following. Hands show up with all fingers intact and well-formed. The legs grow longer, and the feet with all their toes begin to show up too. The dolls make their appearance, followed by the ankles. The head is no longer so disproportionate, and the body starts to elongate gradually over time. The face begins to take on a shape more similar to that of a newborn baby. The eyes migrate to the front of the face, the eyelids develop and will stay closed, and the mouth can even open at this stage. In addition, the organs of the digestive system also begin to develop. The bones continue to grow steadily, and the skeleton gradually hardens. Another change is that the embryonic tail at the end of the spine disappears. The genital tubercle develops, and from it, the sex organs will differentiate based on gender. The embryo can already move in this 9th week of pregnancy, but these are movements that the woman cannot perceive. The 9th week of pregnancy marks the end of the embryonic stage. From this moment on, the embryo is referred to as a fetus, which continues to grow rapidly. The pregnancy symptoms in week 9 are similar to those the woman experienced the previous week. Since this marks the very beginning of gestation, the mother's body is still adjusting and going through several changes. These symptoms may vary from woman to woman. Indeed, some expectant mothers experience significant discomfort in the first trimester, while others feel very little. All of this is completely normal, as every woman and every pregnancy is different. At 9 weeks of gestation, pregnant women often experience the following common discomforts: more tiredness, dizziness, and feelings of nausea. Pain in the pelvis due to the growth of the uterus. Increase in breast size, heartburn and gas problems, mood shifts and cravings. Fatigue and dizziness in the mother are mainly due to a noticeable drop in blood pressure, as the demand for maternal blood increases significantly in order to feed the embryo. The belly is not very noticeable yet, but the uterus has already increased in size, and it is possible that the woman has already gained a little weight. And before continuing with the content of this video, I kindly ask you to give it a like and subscribe to the channel if you haven't done so already, as by doing so you really help us a lot to keep going and to ensure that all the information we publish can reach more people. During the 3rd month of pregnancy, it is necessary to visit the gynecologist in order to begin proper monitoring of the pregnancy and to perform certain diagnostic tests. Initially, urine and blood analyses are conducted to check that all parameters are within normal ranges. The mother's weight and blood pressure will also be recorded, measurements that will be monitored throughout the pregnancy. Following this, the gynecologist will conduct an ultrasound to take the embryo's measurements and verify that it has a heartbeat. The combined first trimester screening, also commonly known as triple screening, is a medical test that provides information about the likelihood of the embryo having chromosomal abnormalities. To perform the triple screening, the gynecologist takes into consideration the following parameters obtained from the maternal blood test and the ultrasound: the placental protein associated with pregnancy, the beta-HCG, and fetal neutral translucency. If you want to learn more in detail about this test, I recommend you to read the article that I've linked for you on the labels. At the first gynecologist visit, an estimation of the baby's birth date will also be conducted. To do this, the embryo's measurements obtained from the ultrasound and the date of the woman's last menstruation before conception are taken into account. Typically, delivery takes place roughly 40 weeks following the date of the last menstrual period, as long as the woman has regular periods. As the embryo develops and the woman's weight steadily rises, the back pain and lumbar discomfort will progressively increase and worsen. Therefore, it is advisable for pregnant women to engage in pregnancy-adapted sports from the beginning of gestation. Walking every day is a good activity that helps to combat fatigue and also improve circulation. Moreover, activities such as swimming or prenatal Pilates both modified for pregnancy, offer numerous advantages. Regarding nutrition, women should continue with the same healthy and balanced diet as in previous weeks. On the other hand, to ensure good digestion and reduce the likelihood of gas formation, it would be important to consider the following recommendations. Avoid carbonated drinks. Avoid foods such as chickpeas, beans, or cabbage as they tend to cause gas. Chew slowly and make sure to take the necessary time to eat. Avoid having abundant meals. Try to have about 5 or 6 small meals throughout the day. Lastly, it is extremely important for the woman to maintain good hydration by drinking water frequently throughout the entire pregnancy. Now we are going to answer some of the most frequently asked questions that users may have regarding this topic. How many months is 9 weeks of gestation? The 9th week of gestation falls within the 3rd month of pregnancy. It marks the beginning of this 3rd month of pregnancy, and therefore the woman is still in the 1st trimester of gestation. Is it normal to bleed at 9 weeks of gestation? It is possible that some light bleeding may occur, especially during the 1st trimester of pregnancy, but any spotting or bleeding during pregnancy should always be discussed with your specialist so that they can properly assess the situation. We would really love to hear about your experience, so I encourage you to leave it in the comments, and I also remind you that in the description you have the link to an article where you can read much more information related to this topic.